Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Shaer, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I welcome pediatrician and friend, Dr. Debra Etelson. Debbie recently made a pivot in her career, and I'm so excited to have her here today to share her story. Debbie and I have actually known each other for a lot of years, but only for 1 week every summer, Debbie, as we've been camp doctors together for many, many years. Although, honestly, it's been quite a few years as my kids have grown up and I haven't been there. So I'm really happy to see your face and to chat with you today. So thank you so much for joining me.
Thank you. It's great to see you too. It's been a long time.
So Debbie, I read your blog post. This is what triggered that blog post about new beginnings. And I was like, I just have to have you here. But before we get into that, I was hoping you could just tell us about yourself. What got you? Why did you become a pediatrician? What sort of got you to this point in your career?
Yeah. So I wanted to be a pediatrician for as long as I can remember. When I was younger, I had what seems now to be pretty mild medical issues. I had awful allergies that made me very uncomfortable, and mild asthma. And when I felt on those days that I felt great, it was just amazing. I felt so good. And so when I saw how a doctor could help make recommendations that would make you feel better, just was a great thing. And I thought, wow, that's a great thing to do. So, and I was encouraged by my parents and my family, and I was, work took a lot of hard work, and there was never no doubt in my mind that I wanted to be a pediatrician. If I was going to be any kind of a doctor at all, a pediatrician. So I went straight from college to medical school and started practicing in 1995. And since that time, that's what I've been doing.
Interesting. So you had a pretty straight course.
Yes.
Yeah.
Yes, I just wanted to go direct. I mean, I realized that it takes a long time. It's a long road. And so it just, went right for that.
Did you have any doubts about, I find sometimes it's hard to make the transition when you're trained in the hospital to sort of go, because you work private practice, to kind of leave the safety of the hospital. How'd you make that decision?
So it's funny what I did. I wasn't quite ready. I wasn't ready initially. After I finished my training at New York Presbyterian and Cornell, I felt like I'm not ready to just go to a practice, or I didn't want to. I felt like there was still more learning to do, but I wasn't interested in doing a fellowship program. So what I did is I became a part of the group of New York Medical College in Westchester, which is where I wanted to live. And I had done medical school there. They had a great pediatric department. So I was able to join onto the faculty of general pediatrics, where I was part of the faculty practice. But I spent about 3 months on service where I was able to work in the hospital with residents. There was still a lot of teaching, learning going on while I was learning how to be with families. And interestingly enough, once I started having my own children, which was a few years into this, I found it a little bit more difficult there was just so many different personalities, coming at me, and I felt like I had another set of children at home and at work, and difficulties with that. So I managed to actually stay for about 10 years. And then my youngest son, who was 13 months old at the time, ended up in the ICU in diabetic ketoacidosis. It was a surprise really to all of us. And because of his young age, I really needed to be home with him. So I had gone to work that Monday, was in the ICU with him that night, and then I took really like a 5 year break in during that time. My oldest son, who was 9 at the time, was also diagnosed with type 1 diabetes. And so I call it sort of my endocrine sabbatical or endocrine
Oh
immersion,
my gosh.
where it was certainly it was certainly clinical time. It was just taking care of my own kids, and then but I knew that I didn't want to leave medicine. I wanted to continue practicing. So when my youngest son was old enough to go to school where there was a reliable school nurse, that's when I went back to work. However, there was no way that I was going back to work in a hospital. I just wanted private practice. I wanted to go back into general pediatrics, have an impact, make an impact on some families, help some families, along the way. And that's what I felt comfortable doing. And I was able to, I was lucky enough to find a practice that was fairly close to my home, where my boss was very understanding that I had 2 children with serious medical condition. And so I would be needing to take phone calls and needing to possibly leave for emergencies. And that was helpful to know. And that's really the only way I would have been able to go back into practice.
Wow. So you
So
had that straight path up until boom, you were hit a double whammy.
yeah, it was definitely boom, definitely unexpected,
Yeah.
for sure,
And
for sure.
so the practice that you worked for gave you some accommodations, it sounds like.
Yes, yes. Ultimately, I really didn't really feel like I needed to specifically leave any time for an emergent type of thing, but there were definitely a lot of phone calls, especially because it was before the continuous glucose monitors are there. So I was literally getting phone calls from, the nurse and how to manage it. And so I was preoccupied for some of that time.
Sure. So
So
did
it
this
was helpful.
experience with your kids change how you wanted to be a pediatrician?
Well, within the first few weeks of diagnosis, I remember saying to someone, I just can't go back to the sniffles. I couldn't, I didn't know I'd be able to do it. And then as time went on, what I realized and what I still, realize is that, the parents, parents are worried about their children's health there's so many different levels. And one of the things that I've gotten very good at, what I enjoy, in addition to, healing the child, and making a diagnosis, is teaching the parent. So, in other words, why is this child getting, repeated ear infections, or strep throats? Like what's going on in the household? What's else is going on in the family, other family members, different conditions. And I like being able to, ask those questions, teach the parent. And I found that because I felt once I understood things better about my own kids, I was able to deal with that better. And while I knew that I wasn't going to be the, primary, I wasn't going to be the endocrinologist or the subspecialist taking care of children who had other chronic illnesses, I could still provide that level of education and compassion for my patients.
Yeah. I mean, doesn't that speak volumes? It's connecting with the parents. They come with such different personalities, different agendas, different needs. And if you can connect to
Mhm.
that, that's really what it's all about, isn't it?
Yeah,
Yeah.
yeah.
So tell me what then happened um, most recently.
So I think what started happening, and it seemed to happen kind of in the wake of the COVID pandemic. initially, initially when patients sort of slowed down and our office, by the way, never closed. So we were always open. Initially, we were really open just to see the babies, the well-care babies, make sure that they were able to continue to have their immunizations. And then we were able to, have people come so they stayed on track. So there was time to see patients, actually more time that there had been beforehand, and I enjoyed being able to spend a full half hour with my adolescents, and that was great. And then when things really started opening up again, and especially when there needed to be testing for every little sniffle or cough, and there was such a high level of anxiety um, of parents about what everything was, and we fit in. We had a policy. We just would see every patient we possibly um, could, and I felt I did not have that time. I did not have that time to connect with patients and patients' parents. In addition to all the phone calls, and I really felt myself beginning to burn out because although I cared deeply, it was just so much responsibility. Um, Turned out to be very high volume, again, high level of anxiety, and I'm not even getting to the actual um, mental health sort of anxiety, ongoing concern. This is sort of just anxiety. Is my kid sick, or I just need him to go but COVID test, and how am I going to get him into the schedule? It was just there was so much of that, and I really I there's always a time in pediatrics. I would say November to about February, where it's going to be a high volume, and we expect that, and we're prepared for it, and nose to the ground, and we're just going to get through. But this really never seemed to let up, and a lot of times I felt it was almost being dictated by other people, whether it be schools or airlines or other things that were requiring doctors to do, and I just felt like I wasn't enjoying it, and I wasn't being the doctor that I wanted to be. I wasn't able to um I wasn't able to bring all of what I knew I could bring to a patient and have that impact on a patient's family. I wasn't able to do it. When I realized it wasn't only related to that few month period, and this just seemed to be what it was going to be like. In a few weeks, slow weeks here and there. It really began to upset me.
It's so interesting you say that. As you're saying it, I'm realizing, there's a time and a place in practice for sort of that urgent care type, like the walk-ins, the quick visits, just sort of like triage and troubleshooting. But that has to be separated out from the time that we need to go deep to deal with the mental health things and the physicals and the things that really take your time and attention. And when you're asked to sort of do all of it, it can become a little bit overwhelming, right?
Correct.
Yeah.
Absolutely. Absolutely.
So what did you do?
Well, so last fall, and I think part of it might have been when, last fall, even before it got busy, I was feeling the ramp up from just having finished camp, where there were all these, demands and outbreak in camp, and now we need to test all the kids, and then the school. And so I actually started to look for a possibility of doing, something non-clinical, whether it be something in, pharmaceutical or other clinical studies. I began to, uh, go online and just hear from others, started you know, different like chat groups with, people reading about it. Um, and then I ended up speaking to a life coach for a little while. It was, well, a life coach, sort of career coach. Someone who I had known from the field, someone who I had respected. and who respected me and had known my work as a pediatrician. So I didn't have to explain all that. It was someone who had actually read my blog. Um, and so we started talking, and that was very helpful because Sherry really helped me understand my worth and my value. And at some point during this, urgent care type of situation, I really felt like I was just there to sign forms and I was just there to do the work that other people needed me to do. And while I'm in a group practice, so I understand that I'm seeing other people's patients, that's fine. But I felt like just because I had an open, 10 or 15 minute slot in a schedule, I was there and I was available. And um, I did not feel valued. I did not really feel particularly valued. And so my work with Sherry, I really began to, understand my value and how empathy and compassion matters, and that was helpful to me. And I actually considered starting a practice. I don't know if it was really a practice or a service where parent I would help other parents that had children with chronic illness, not just diabetes, but anaphylactic food allergies, ADHD, help be sort of a navigator on after a child is diagnosed with a
Mhm.
some kind of condition, how you go about getting through life. And so what had happened is that before going back to work, about a year or two before going back to work, I started a blog called MD Mommy, and it's mdmommy.net. And I needed to do this to process all that I had gone through. Yes, it was really traumatic to go from being a young attending three children, and then, having this all of a sudden, and it was hard to just, go back to work. So in this blog, I really talked about how you can have children with chronic illness and still get through life. And it's a lot of work and it's a lot of worry, and how to do that. And I wanted to be able to, and that helped me a lot. And once I was ready to go back, I was ready. Um, and I felt like I maybe could use that as a career where I could help parents with whatever it is. It just so happened that my experience with um, mostly diabetes, but also celiac disease and anaphylactic food allergies and asthma. My kids have it all. Um, but I want to be able to tell parents when they're losing sleep at night and to say, it's going to be okay. These are the steps you need to get there. In other words, not specific medical information, but this is how you're going to get there. Um, but the road to that, I realized, would be difficult. The marketing involved, and it's still something that I would like to do. I just wasn't able to rely on it just
Mhm.
at that point. And so what happened is that I was actually at a social event and I met somebody who who knew me as a doctor, knew that I liked being a pediatrician, and I started to speak to her about the challenges that I was going through. And she knew about a an opportunity to work in a practice which is further away from my home, which now I could do because my children are more independent, um, and that I would be able to help grow a practice, um, and really be able to get to know families in a new community and be the doctor that I would want to be. But by growing the practice, it was going to give me time to be able to do what I feel like I do best, which is really get in there and speak with these people. So it's really, I was just so happy that I was able to have this opportunity to stay in clinical medicine because I really wasn't ready to leave. I just was not happy continuing. It was not sustainable what I was doing.
This is so interesting. First of all, I love that you worked with a coach who helped you sort of change your mindset in a sense so that you didn't just like um run away without kind of processing through and really realizing what was most meaningful to you. And then isn't it funny how things work out? Like somebody you just randomly connect with somebody who gives you the gift. I mean, it sounds to me like the gift of time is what you wanted. You want time with your patients.
Yes.
And
Yes.
I think for me, I always just tell people like the connect with what's most important to you. Like some people love the urgent care type of pace, and that's an amazing lifestyle also. But if for you it's digging in deep and dealing with the chronic illness like that, this really worked out nicely for you.
Yes. Yes.
You've
I'm
sort of
glad that
created it for yourself though by being aware of what was most important to you and managed to stay in the game. I love your idea for supporting parents of children with
yeah,
chronic medical conditions. I think that's a great idea.
I think there's a need. There's definitely a need out there. It's just like I said, like hard to, to find the parents. So I'm
Yeah.
still considering that.
So let
So
me ask you, you have your three boys,
mhm.
right? Are any of them interested in medicine as a career?
I think so. There's a possibility that one of them might, but not really like a burning desire. I think
Mm-hmm.
not sure why. I feel like maybe a few of them feel like it's so close, so much of their,
Yeah.
life
Yeah.
is so involved in that. And then they've seen the struggles that I've had and that other doctors have had.
Yeah.
So
So a lot of doctors, you ask a lot of doctors, would you tell young people whether or not to be a doctor? How would you feel? What advice would you give your kids if they were interested?
I would say I would say think long and hard and don't do it as a default. Like my mom's a doctor, maybe I'll be a doctor.
Right.
There really does have to be a calling. It's long and it's hard and it stays hard,
Mm-hmm.
and as it should. It's important. It's a privilege for what we're doing, but
Yeah.
it has to be something they really, really want to do.
Yes. It's a calling. You said you didn't want to do that out of medicine business because you thought it
Yeah.
would be hard. But let me tell you something, doing hard things is something you clearly have done in your life. If you really wanted to do that, you could do it.
Mm, hmm. Yeah.
Oh my goodness. All right. So tell me, this was such a great story. Tell me what advice you would give to sort of doctors just starting out or any clinicians, NPs, PAs, physicians.
So I feel, for those just starting out, you need to be patient. In other words, I've been doing this for 25 years and I realized that this just was not the way that I wanted to, practice medicine. I think for people starting out, I think you need to keep your eyes open. Um, but also no, sometimes I hear sort of disgruntled new new starting out that the older, when we're senior physicians have different, schedules and that kind of thing. And for a lot, so do they under so be patient, give yourself some time to figure out maybe you do love that sort of urgent care kind of thing. Give yourself time to figure out what it is that you like, the environment you want to work in, and expect to have those difficult times that you need to go through. Many things have a solution, but sometimes you really just need to get through the grind. That grind is, expected. But at a certain point, you need to get your head out of the sand and really look around. I think that it took me a long time to do that, a long time to do that. And so it's your responsibility to really see what's out there it's easier to see what's out there now, that, networking and all that is much more open. But I would say to not wait too long if you're in a difficult situation. I would say just look what's out there. Keep updating your resume, um, for sure. And try not to spread negativity within the workplace. So or get caught up in it. I would say there's always going to be people, there's a lot of negativity out there, and it's so easy to get sucked in. But if you can try to sort of refrain from doing that while you're at work, or table that, maybe talk about that in another time, that would be better.
Yeah, that's great advice. For me, I always say, if you know what you want, then it's easy to stay on track, right? And there really are a lot of opportunities out there. And sometimes the decision is to leave medicine, but there's a lot more than where you currently are if you're not happy. So
Right. And to know your worth, and, to think about your worth, but to be patient as well,
yeah.
to be patient as well.
All right. So,
So,
Debbie, tell me, where can people find your blog?
okay. So my blog is mdmommy.net. And yeah, I talk about my kids and how sort of got here. And really, I'd like to say it's sort of extricating those good moments that you have, with the knowledge that it is hard to get there. It is hard to get there.
And it's a
That's
journey,
the
right?
message that what I want to give. I want to give to parents.
Yeah, the journey. All right. Well, Debbie, thank you so, so much for joining me. It really was such a pleasure seeing you again and having you and hearing your story. It was inspirational. Send
Thank you.
regards to your kids for me. I haven't seen them since they've been on the basketball court at camp.
That's right. All right. Well, enjoy, and thank you for this opportunity.
All right. Take care, Deb.
Take care. Bye-bye.
That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at shaercoaching.com. Thanks for listening, and don't be afraid to live your best life.